Okay, so we have about 45 minutes or so, and I want to talk about the journey for both of you to find your way to n-Lorem, both through Sloane and Susannah. So in my mind, for some reason, I had you starting, but that doesn't have to be the case. Yeah,
he should start. Yeah.
Okay.
Yeah, you're the reason that Sloane's here.
Well, I know she's speaking tomorrow, but I wanted to. Since Susannah was 2 years old, right when she was diagnosed, we have a champion and our incredible doctor and clinician, Dr. Chung, who's over here, over there, who is truly like Jen, but is truly like family to us, and really started this whole n-Lorem journey with the n-Lorem team. And geography can't keep us apart because I still send her emails and phone calls and bang her door down. But when she moved to Boston recently, Dr. Bain became our PI, but Dr. Bain had also been Susannah's doctor in different forms of neurology. So I just wanted to say we have Stan always talks about community, and community transcends an Amtrak ride to Boston from New York for sure. So Susannah was diagnosed when she was 2 years old with a mutation in her KIF1A gene.
But even before the diagnosis, there were things that were leading you to go get a diagnosis, yeah? So what was happening?
Yeah, Susannah's legs really stopped working. She couldn't, it was my wife who, I wish she could be here, she's far more eloquent than I am, but Susannah stopped kicking in the bathtub. And we have this thing that we did with both kids where we would say, kick, 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 kick in the bathtub. And she did it for a little bit, and then she just stopped and couldn't. And outside of the bathtub, she was, she would stand up with help and then just collapse. And she was dragging her leg. And so
these are alarming things. And so you're, okay.
Yeah, and she also has, she has epilepsy, like Dr. Bain was saying, and that was getting more and more clear as time went on. She would have, like Dr. Bain said, these arrests, these times where she would just go away from us, and we wouldn't be able to get her back. And that also broke through to seizures during the day. My wife or I, actually still always sleep with Susannah because she was having seizures at night. And now her seizure type is different, but far less frequent, like you saw. And she, she's sorry, I don't.
No
questions.
Right. So the one thing that I'm curious about is if I'm an average human being on the street and my child, something terrible has happened to my child and I don't know what it is, how do you get to the point where you're getting a genome sequenced?
So we live in New York, just a few blocks away from Columbia. So we're fortunate enough to, through various avenues, one of our original doctors, not Dr. Bain or Dr. Chung, had us get this extensive.
So your pediatrician, you went into your pediatrician first or something?
Oh yeah, we went into our pediatrician. She was like, I don't know what's going on.
Right.
And then they referred us to a neurologist who's a general neurologist. And
that person probably also said,
had no idea what she was doing. And she referred us to a research study. And in that research study, that finally, after a couple of months, came back and confirmed that. And through a friend of a friend of a friend, we were able to reach Dr. Chung, who, very few seconds after I emailed her, she was so kind to get back and say, do you want to come in tomorrow morning? And she flew back from wherever she was just to see Susannah, and she said, would you like me to explain the implications of this disease? So we were fortunate enough to be near Columbia and be near, the only doctor who had clinical experience with it. Yeah.
So you've been sort of wandering in the dark through well-intentioned, but people who did not actually know the answer. And then Wendy says something like, can you see me tomorrow? That had to feel like, oh, we're moving in some positive direction here.
Yes, in that we found somebody who could clearly explain to us what was going on. That was incredibly reassuring. And then it became devastating when she did explain in a really compassionate and empathetic way, what this disease meant, and especially for Susannah's,
outlook. Yeah.
And her brother. This is when I get teared up, is when I talk about Nat, Susannah's brother. It's really a family. I mean, and n-Lorem and Jen and Wendy. It's it's really a family. It's incredible.
But the issue for Nat, you mean like he has to watch his sister go through this? That's the painful part?
It's really, he's saved her life before, literally pulling vomit out of her mouth in the middle of the night. Now he's older, he's 12, and I had to, once give Susannah CPR, and he saw it and freaked out, and it's a real thing.
Oh yeah,
sibling
yeah.
stress.
So Wendy gives you this bad news, we'll say, because she's detailing something, and it's like, well, we don't really know what we're going to do about that. But how did you then go, okay, now I'm with n-Lorem and we might be able to do something?
Well, Wendy shepherded us through really how to really kind of galvanize a community together. And so while there were only, there was no one like Susannah that we could find, and we only can find a few people in literature that had anything close to this disease. And we, with Dr. Chung's help, and then eventually with Dr. Bain's help too, we started building this community and really having.
These are all KIF1A.
These are all
mutations.
KIF1A families. And actually, there's an incredible KIF1A family here we still have our natural history study, which is really an endpoint enabling study called the Koala Study that Dr. Chung runs. And they flew here from Chile. Are they here? They might be in the next room. Yeah. Yeah. So they came for both to see Dr. Chung's team, who also includes somebody who is just the kindest person who we love, and that's Joanne on Dr. Chung's team, who's here too. So everybody comes here.
She's over there.
Yeah, Joanne. And so yes, and that was, the community came together, and it was really Dr. Chung and the n-Lorem team who.
So let me ask about this community. So you have this community growing, and what's the plan? Like, what are you thinking as a community?
Two things. The plan with our advocacy group was to find more people, to find more kids that we could enroll in a natural history study to understand the disease. I hate natural history study because, to be honest with you, I don't give a shit about understanding this disease in 10 years in literature, right? We need to help our kids right now. But the goal was to find more kids and to support as much preclinical research as we can, and then to translate that into a treatment.
Support meaning financially?
Yeah,
meaning so you're raising money for this?
We're raising money for this. We're writing letters of support for grants that otherwise wouldn't get, but where it's one of these sort of begging, how can we have there's nothing, and then through such incredible work from both of these teams, we met n-Lorem.
One more thing about the community. Was the point also to sort of raise a collective voice?
Absolutely.
So that, if your child doesn't have this, you don't know about it. If you don't know about it, you don't care. So the idea is, can we make enough noise so that people are forced to care about this?
Oh, absolutely. I think Dr. Bain and Dr. Chung and everybody at n-Lorem knows I might not be the most scientifically savvy or have much business acumen, but I can be incredibly loud. And so I did chase a lot of people down, but it was to we all got together and said, listen, we have to shout from the mountaintops because that's the only way that somebody will hear even an echo of us. So we did, participation is the name of the game. And if we can get people to participate, to apply to n-Lorem, to participate in the Koala Study, to talk to Dr. Bain, just to participate, that is a huge win. And so we were able to, and now we have around 700 families.
Oh my God.
Yeah.
I had no idea it was that many.
Yeah. Yeah.
So when you're talking about raising the voice, what did that mean? Were you like writing letters to your congressman? You were doing that? Yeah.
We were talking to members of Congress. We were trying to figure out we were contacting different companies to get free testing for kids.
Testing for genomics.
So Susannah's fuzzy feet, her the peripheral neuropathy and the pain she had really mirrored Charcot-Marie tooth, and also the seizures mirrored Rett syndrome. So we would go and ask, physicians, how many of your families have clinical diagnosis and how many have molecular diagnosis? And the ones that didn't have a molecular diagnosis, we would advocate to get them that diagnosis. And the yield would be 1 or 2 would actually have KIF1A. And when Medicaid started covering, I think you guys know better than me, I think 12 states now cover Medicaid covers whole exome sequencing. The first one was in Michigan, and we had 20 new patients within 2 weeks from Michigan.
Good God.
Yeah.
I mean,
none of them are the same though. The mutations are very different. They're
but they were unknown until the sequencing happened. I mean, this is what Stan's talking about.
Yeah.
Okay, so eventually someone says, hey, there's this group. It's a nonprofit foundation. It's called n-Lorem, and they might be able to help. Yeah. How does that happen?
Just through Wendy, through Dr. Chung, and also through, like I said, would beat down people's door. And we knew, and I knew from Dr. Chung had told me that, antisense is probably the nearest term treatment that we could find. So she said, mirror these certain communities with these certain diseases that had similar movement disorders and things like that. So we did. I mirrored them and realized, and I would bang down, Ionis's door and everybody. And then Wendy and the n-Lorem team said, there's going to be this foundation called n-Lorem with very high ethical standards. So Susannah was blinded, of course, and
blinded in the application process?
Blinded in the application process. Yeah. So even though I had reached out to people, it was not, that was sort of the way to get connected with the application more than people. And so Dr. Chung worked so hard to get us that application. And then when we finally heard that Susannah had been accepted, it was I feel like it was just a paradigm shift, not just for our family, because Susannah was getting very, very sick, but for everybody. I mean, we had this, all of a sudden, this opportunity that we knew and we hoped that, Stan uses the word pioneer, and I really believe that. We hope that this was the tip of the sword for many, so.
Yeah, I mean, this is the second, so I'm struck by this idea that just getting accepted into the program, whether or not the ASO works, it's like, oh my God, okay. Or now we're at least moving in a direction. There might be something. It's like hope. It's like, Stan keeps talking about.
Yeah, I hopeless is a hard thing for me to, isolation is very, very true. I look at hope like, and I've said this before, so forgive me if you've heard it, like a baseball, I equate things to either fire or baseball, right? So hope is like a baseball swing, and I coach my son's Little League, and I said, sometimes you're in a slump and you just need to adjust your swing a little. So sometimes I just need to adjust my hope and realize that hope is there, but you need to adjust it and find the right people. And that was a moment where I felt like we actually got a hit with that, adjusting my swing there.
Is there a metaphor for fire you want to use?
Yes, but it gets into mechanism of action and different kinds of treatment. It's too long.
Okay, all right.
Yeah.
So let's stop there and we'll turn to Megan. So Megan, can you, because I actually know the least about Sloane's story.
Sure. So Sloane was typically developing until about 6 months. I have 2 older kids. So she's a COVID baby. She was born February 2021, and music classes were closed and my kids weren't really going to school, and my mom was taking my older kids, and I didn't really know what to do with Sloane, but I did notice she had like a head preference and she was getting a flat spot. So I took her to the chiropractor, that didn't work. I took her to the pediatrician, they showed me some massage techniques to do, that didn't work. So
the first symptom is she preferred to sleep on one side?
I don't know if that's is that a symptom?
That's the doctor.
Is that a symptom?
What concerns you first? When were you first concerned?
So I started seeing an occupational therapist to, loosen up her muscles.
Yeah.
And since we weren't doing like the music classes, it was kind of something to do with her every week. And I became really good friends with her, and I enjoyed spending time with the occupational therapist. She's still on our team and one of my best friends now. And starting at 6 months, we started practicing sitting. And she had decent head control when you held her on your hip. She didn't really need support at her head anymore at 6 months. But then when we practiced sitting and moved the support from her core down to her hips, we called it a bobblehead. Her head was just like this. And I was like, this, being a mom of 2 older kids, is not normal.
Yeah.
And I said to the occupational therapist, is this normal? And she's like, it's not a huge concern, but I'd take her to the pediatrician. They blew me off, like I'm sure so many other families in the room can have similar experiences. And I just had that mom gut. It's real. I knew something was wrong. So she said,
sorry, blew you off. I'm not to, to criticize them, but meaning like they're like,
she'll catch up.
She's behind. It's probably COVID. She's not interacting much with other kids.
Totally. Are you doing enough tummy time?
Yeah.
No, probably not.
Yeah.
So they're like, come back in a month, 6 weeks. We'll make a plan then if it's still, if she still has that core weakness. I was like, no, there's something wrong.
Yeah.
Our occupational therapist said, just make an appointment with the neurologist. In a month, it will probably take you that long, if not longer, to get in. If she's better, you cancel it. If she's not, you've got the appointment. I was obsessive on the computer. I need a cancellation. I need a cancellation. We got an appointment, and she recommended doing just a panel, something that Luke didn't mention they had done. They got KIF1A on a ton of panels so that you didn't have to do the whole genome or whole exome sequencing. And honestly, we just got lucky. She gave us a panel KIF1A was on.
You got that on the panel.
Well, yeah, so one of the first things with guidance from Dr. Chung and Dr. Bain was to really go out and find, so our kids have optic nerve atrophy, Susannah's losing her vision, they have 8. So I would go out to the different genetic, GeneDx, all the companies that, we all use, and say, hey, we really need to get KIF1A on the movement disorder panel. We really need to get KIF1A on the seizure panel, on the pretty much every challenge our kid has. And so that's when we really started finding more like Sloane.
Huh. And they were amenable to that?
After me being very loud.
After 10 or 15 calls.
Yeah, they were. I mean, everybody has great intentions, and you just have to tap into those intentions.
You just had to really prove that this was important to them, and that it would be useful.
And that it's going to save kids.
Yeah.
And look at my daughter. How can you say no?
Yeah.
Look at Sloane. How can you say no? Look at Taste. Look at that. How do you say no to this?
Okay. All right. Sorry. So you get a panel.
We happened to get lucky enough to. She started with one panel that KIF1A was on, and it came back, I don't know, like a month after we got it. So we are absolutely an anomaly. I noticed something at 6 months, and she was diagnosed at 8 months.
Oh my God, yeah.
So that never happens. So within a few days of getting the genetic test results, we connected with Luke and KIF1A.org. That was I think the end of August, and we saw Dr. Chung in New York December of that year. And we said to her, what are our options right now? And she brought up n-Lorem, and we asked if she would be willing to nominate Sloane. And Sloane was accepted, I think, maybe 15 months after that, with the intention, I'm pretty sure, of making a new ASO for her. And then when they started doing her sequencing, found out that her SNP was in the same spot as Susannah's, and so the same ASO was
actually,
amenable.
So that puts you at about 2 years for Sloane?
Yeah, I think so. And then she got her first dose in May.
Right after she was 3.
Right after she was 3.
I mean, we're talking about pioneer patients, but if you hadn't done the hard work, if you hadn't started the foundation, if you hadn't worked on the panel, then this is a lot slower for you.
100%.
Huh.
Yeah, without a doubt.
I mean, you must feel that's a positive in life. Yeah, that's a great thing.
Yeah. It is, but it wasn't just me. That's.
I know. Yes, of course.
It does. It was our whole community that grows and grows and grows, that participates and participates and participates. And if you can say, look, we have this community that's growing and growing and growing. If you're a forward-thinking company, you're going to say, okay, well, look, in 5 years it's going to be, or 11 years, it's going to be 700, not 7. And so we're still trying to do that. But it was really, Wendy and Jen, and then every single family who came on, as soon as they started participating and loving each other.
Yeah. So let's talk about the dosing. And do you want to start weighing in on these things, because
this is for them. It's the patient colloquium.
Okay. All right.
I can chime in when you need me.
Let's talk about the first doses, and we'll start with you.
Yeah. Well, we were very, very, very comfortable because, there was nothing else.
Yeah.
We knew that it was very safe, right? From everything that we've heard.
And so does n-Lorem tell you that? n-Lorem's like, look, here are all the ASOs no.
No, not yet. But we were, it was really happening through our doctor, Dr. Chung, and Dr. Bain, and the whole collective team. And it was, very well laid out for us. And Dr. Chung just said, look, these are the things that, are going to happen. One of the things that's amazing about n-Lorem and Dr. Chung and Dr. Bain is they're not just tasked with treating our kids, but with educating us, right?
Yeah.
And so we were really well informed about the process. And after Susannah's first dose, I was really, I would always be looking for things and say, look, that's happening, where my wife is a lot of it more grounded than I am. But we really did start seeing different things after the first 1 or 2 doses. But I say this a lot, it was the first time that we went, and she spent a lot of time in the hospital between emergency room and everything. The first time we left the hospital feeling like something good had happened.
That's what Kelly was saying too.
Yeah, right. Yeah, it's we leave the hospital usually, and it's like, oh my God, is this really? We have to do this next. But we left saying, okay, she just had a treatment. We don't know what to expect, but this is the plan. So there was a plan that, and just by me saying a plan, I'm sure is far more trivial than what actually happens. I mean, this group, really is Dr. Bain is fighting for us every day on the phone with insurance people, figuring out what we should be measuring now after a year on drug. What has changed? Susannah had a lot of tremors. Her tremors totally resolved.
That's the picture of the nails, the nail polish.
Oh yeah, she was able to paint my fingernails.
That's his fingers.
Those are my fingers. You find anything, right?
Yeah.
But she was also, she was. You can the first dose you see in the upper left. Well, I guess here upper. I don't know, the picture with Dr. Chung and Dr. Bain.
That was dosing day.
That was first dose. That was dosing day. That was the day that everything changed for us.
So what are these small things that you began to notice? But the tremor, obviously. Other things?
Yeah, we did notice a lot of other things. But I will say the tremor. Dr. Bain was saying it in her half an hour ago. The little things, like when her tremor resolved, we were able to have breakfast as a family and talk about things without someone making sure that Susannah wasn't falling, someone making sure that she was actually getting food into her body. And when the tremor was resolved, she was eating by herself, and we were able to my son Nat was able to go to school without feeling this rushed anxiety and so that was huge.
So it had an effect on the entire house.
Whole family. So you see the Halloween, can I talk about the Halloween pictures there? Susannah, this was before dose. She was pretty much
blah.
She was just, and I don't know if this is even a clinical term, but not catatonic, but her day would end at 2:00. She was just off on her own, having these hundreds of these episodes, and she was just off on her own. And then you see the one right next to it was after a year, and she's so much happier.
Yeah.
And so we see just happier, and she's not writhing in pain because her legs are hurting her.
Yeah.
So anyway.
Yeah. Okay.
Yeah.
Yeah, so like I said, Sloane started getting treated, dosed in May. So, we're in a little bit different position than Susannah because she, her disease has not started progressed as much, and she was still, upwardly, positively progressing in skill, just kind of slow and steady progression. So we're seeing minor changes. The things that we're seeing mostly, I've noticed a huge change in speech and her ability to verbalize and make correct sounds, and she can pretty much mimic anything you say now, where she was saying the same sounds before. Her core strength is much better. She's gotten a little less tone in her legs. She also had tremors not as bad as Susannah's, but those have pretty much subsided, and now I think Dr. Bain has a video. She can actually pour something into a cup, which she never would have been able to have.
You want to show that? Yeah.
So I think if I do this, that worked out well.
She never could have done that before.
Down. Singing the national anthem. Good. Try to go backwards. Down. Good. Down. Good. And down. Done. And down. Good. Oh, Sony, that was such good pronation. Good job, Penny. All right, say bye-bye. You say bye-bye. Bye-bye.
I don't know when it starts.
I don't either. I think it's close.
Could watch it forever though.
And what I'll say is that, part of this is just being in constant communication. And, I know when Dr. Chung was running the trial and Joanne was like the point person in terms of like telling you what you're doing and figure out, okay, was that itchy skin from the ASO? Oh no, it was just the sheets. Yeah. And so like just constantly being in communication to saying what's actually real and what's not.
Yeah.
And I think, having that just open communication, as hard as it is really important to making sure that we figure out what are the trends, what are we seeing that's actually meaningful.
Yeah.
And so it's just a constant kind of going up. For Susannah, the dosing has been the same. So you start and then you go at 4 weeks and then 8 weeks and then 12 weeks thereafter. Susannah, we are still finding the right dose. For Sloane, we got up to 80 and that was the most recent one. Now we're gonna decide if we wanna go up to 100 and that's gonna be a shared decision making.
Oh, right. Is Susannah still at 80 or is she gone up?
Susannah went up to 100 a couple times and now we're back down to 80 and we're working through it.
Yeah.
Yeah.
So does 80 feel like the dose then? No, we're
I
not
don't
sure.
know. We're still working through it.
What's incredible is that Dr. Bain said about this communication, it's not just with the medical team. Dr. Bain has been seeing Susannah for a long time clinically, and but we're really involved in that. And we were when Dr. Chung was at Columbia too. We're really a text in the morning where Susannah wants to say hi or something, and she did a text saying, "I want to tell Dr. Bain to eat ramen." I don't know.
We're still not sure what.
I don't know what that was, but she can tell. The great thing is, you asked about things that we noticed. She can speak in multiple syllables right now, which never was happening, and was in fact, speech was going away.
Yeah.
But she can learn and ask about what the words mean, and she can have these. And I said it the other day when I was talking with Stan and Jen, is that it was like a veil was lifted. And so she's able to, she loves sunsets. So she's able to talk about, look at that, orange and purple sunset. So she can do things that, and Dr. Chung had said, and it was phrased really well about Susannah. She said, I feel like there's so much inside of Susannah that she just can't get out.
Yeah.
Now she's getting it out, and then this took her about 10 months to learn. What can happen in 10 months is, a lot. This was her dress rehearsal she came to work with me, and there's audio here. She's like, shut up, Dad, I get it. Dad, shut up.
Land of the free and the home of the bravest.
And a week later, she sang that with her class in front of 400 people at the FDNY hockey game.
Huh.
And it was so amazing because when the guys were tapping the stick on the ice, we looked up and you could tell that these kids, and Susannah leading the bunch, were being celebrated, and they were proud of themselves.
Oh, they were hitting their sticks on the ice as
the
applause.
guys were
It's
that's
a
a
hockey
hockey
thing.
thing, right?
Yeah.
So, as we've talked about pioneer patients all day, but there's a difference between your two children, right? So the age. And I want to ask Dr. Bain about this. With neurological conditions, the earlier the better, right? So for Sloane's case, there's probably a difference in what you're seeing because of the early treatment for Sloane versus Susannah.
So I think there's a couple points. Number one, actually, Dr. McManus talked earlier about clinical heterogeneity, right? You have the same disease, but multiple people. And we know in a lot of these disorders that you could have the same genetic, even the same exact typo in the same gene, and in 10 people, it could look totally different. And I don't think science has caught up to why that's the case in all situations. So we do recognize that everybody looks a little bit different. And then why do you give the same medicine to 10 people and they all look different? We think that earlier is better. We don't know that, but we hypothesize that's the case. I think importantly, and I'm really glad that this was brought up earlier from Stan about, I don't really want to wait, right? I don't want to wait 10 years to go through all of the science and do all this rigorous methodology. Yes, it has to be done, and we're doing it. And like KIF1A is doing the koala study, and they're doing the biomarker study. But if we have a safe drug and we think that there's preclinical data, I personally have a hard time sitting in my patients' visits just saying we're going to wait until we have enough preclinical data and then get to that point. Like I just don't, clinically, I'm the one sitting there, and I think most physicians out there feel that way. Neurology, there's an old adage, you could diagnose but you can't treat. We're actually like in an age where that's not true, and so we can do it safely. And I think as long as we owe it to ourselves to be scientifically sound and to be collecting our biomarkers and doing the studies and making sure we have target engagement. Those are all really critical questions that we need to answer, but we also kind of owe it to our humanity to kind of move forward if we feel like we're in a safe position. So I think that was the goal here. Obviously, the questions of ethics is hard, right? She is symptomatic, not the same symptomatic, but she is seeing that she wouldn't have gotten the diagnosis in the first place. So I think it's just, we have to be human and think about empathy in addition to rigorous scientific methodology.
Safety, right. I mean, so if you think about someone like Connor's story and how long that journey was, it should be getting shorter, right? Like we talked about this when we pre-planned this panel. It's like, how can this get shorter so that it doesn't take as long for someone to get a diagnosis and get an ASO built for them? Do you have thoughts on that?
Well, I think advocacy groups are driving it. There's clinicians and clinician teams like Dr. Chung's Guardian study, which was one of the pivotal newborn screens out there that are really trying to show why we should be doing testing earlier, who are the ones we should be doing testing earlier. Can you go out to the Rett foundations and perhaps for my other disorders, the cerebral palsy groups and the people who didn't get the positive test? You have to just keep asking. I feel bad saying it, but like every parent who's in this room knows that they're the ones who had to say, that's not an answer, that's not an answer, I want an answer. And I think it definitely involves a fierce advocate parent to push you forward. We're moving forward towards panels coming out for free for a certain amount of period of time and accessing research, but not every clinician can do that, absolutely. Even in New York City, you can't always get free testing all the time.
Yeah.
It's a societal issue, and it has to be dealt with on various levels, from the parents to the clinicians who are doing the genetic testing and having your genetic counselors sit there and fill out all the prior authorization forms and the appeals, up to the Hill and saying like, you need to be able to do this.
Is there I mean, I think I know the answer, but I'm going to ask anyway. Is there a way where every child is screened at birth for something? I mean, not only KIF1A, but every sort of thing like that?
So it's not done yet. I mean,
Yeah.
I will put in a plug for Dr. Jung's paper that just came out recently on the Guardian study, where they teamed up New York Presbyterian along with New York State doing newborn screens. And I believe that there are a few other similar studies looking at levels similar to the newborn screen in each state. And then the question is, how much evidence is there to say what should be included and how do you include that? But I think the fact that now you are starting to get treatments for these ultra rare diseases is going to be really important.
I do think in addition to that, whatever genes do get added to newborn screening, you know, I think when we talk about an ethical challenge, I think that we do need to say, these are the, you know, myriad genes that you were tested for. These are the ones that weren't on that. So you need to consider looking beyond the ones that were on the initial, even though they're much greater number than have available now.
What do you mean, much greater number of patients?
Yeah, so no, much greater number of genes on a newborn screening panel.
Yeah.
And you know, it is important to say to a family, you know, there are still other genes that aren't on that panel.
Right.
And you should explore that to see if that's what's causing.
Right, you're saying if a family comes in and they say, well, we've already screened you for these things that's not on here, you have to say, look, there might be other things that are not on this panel.
Right.
Well, and I think you made a comment earlier about n-Lorem and us like educating you guys. I see patients every single day, and I'm like, okay, so did you have did you have an MRI? Do you remember that? Yes, you can remember that. Did you have the sticky thing on your head, EEG? Yeah, I've had that. Have you had genetic testing? Oh yeah, we did it. It's totally fine. Everything's normal. But it's not that simple, and you know, parents don't know that, and families don't know that.
I do not have a science background, so I was that person. I got the basic testing done when I was pregnant with my oldest daughter. I thought we were in the clear. Yeah.
You mean that they give every pregnant
Except for like the
person-
chromosomal testing that they do.
Yeah.
So I that came back. I'm like, we're great.
Yeah.
Yeah, like ideally there would be, well, we have 10,000 rare diseases, or that number keeps growing. That would be the, you know, jackpot if we can just.
Right, the current, and
Yeah.
you just have to update it yearly.
But I think along with that is that, you know, there's the ethical dilemma of if you're going to test for something and we can't do anything about it, what happens then? And so we have to be mindful.
Yeah.
Clearly, n-Lorem is changing that strategy because now there are potentially treatments, but we have to be rigorous in saying, okay, how do we look at this information, use this information, not just one by one, but collectively put it together and show that there is, you know, these are safe and they are efficacious. That's the hard part.
Okay, so it's been so how long since Susannah?
2 years.
2 years, and for
Just over 2 years.
Sloane?
5 months,
5 months. Okay.
almost 6 actually.
What have we
Next.
seen with Susannah over those 2 years?
Oh, I mean, her cognition has improved beyond measure. I mean, well, not beyond measure because
It can be measured.
spend their lives measuring things.
For different measures.
Different measures. But for us as a family, it's pretty amazing to see her, the way she's interacting with people, and that she made it through sleepover camp when her day usually ended at 2 p.m. because she was would get a call, she had a seizure at school or something happened. But she's making it through days, so she just has a happier life right now. She can. There was a word, Dr. Bain said, Susannah wears certain PJs to dosing that she just loves.
Yeah.
And Dr. Bain said the word, so that's so fashionable. Fashionable, is that right? 4 syllables? Susannah said the word fashionable. She could never say 4 syllables before. So
Did she say, like, I'm so fashionable?
Yeah, she repeated the word after Dr. Bain left, and I was like, yes.
In a sassy way.
In a very sassy way. But she could not communicate with that complexity. Yeah. Now she has the scaffolding to explore things and to learn. She's learning things, you know, which we never thought would.
The sleepaway camp, was somebody sleeping with her at night? Or
Well, it's this really incredible sleepaway camp called the Southampton Fresh Air Home. So it's for kids like Susannah and Sloane and other kids. So she had a nurse and a para, but she had a fairly big cluster of seizures where they called 911 and had and she looked forward to this camp for so long, and she definitely would not have been able to go back and complete camp and sleep over had Dr. Bain not been on the phone with the ER doctors and with the camp and with all the advocating for Susannah to have this right and this experience that every kid should have.
The seizures happened at camp?
Yes, and so it really scared them enough to.
Said
so
we can't. We're not
raced over to
equipped
the
to handle
ER
this.
and met them.
And Jennifer said, no, this can actually continue.
Or said, well, let's go home with.
Let's not talk about liability, okay? I spoke with the medical providers. I provided reassurance. We got her back to camp.
And she went back to camp.
Yeah, and she went back to camp. So Dr. Bain was thinking about her quality of life and how upset she would be if I ripped her out of camp when,
She just got there.
She
She's
just
only
got
halfway
there. So she was again not burdened, but having to take on the challenge of educating now camp nurses and camp doctors.
Right.
So, you know, yeah.
I mean, I'm quite shocked by that. That 2 years prior, you would not have thought that was possible.
Her day was over at 2 p.m. Yeah. No.
I mean, how did she feel about being away from? Did you see her? Did you check in and see her every day, or she was?
Yeah, I mean, it was closer to home. We didn't check in and see her.
Wow.
And it was incredible. I mean, it was something she really wanted to do, and we were like, no way. But we didn't want to say that to her.
Yeah.
And so we said, yeah. And it was just like going into the unknown again. And now we know that she is this brave, incredible girl who can go to sleepaway camp. Like,
Yeah.
you know.
I mean, I know plenty of kids who are normally developing who would not like sleepaway camp.
I hated sleepaway camp.
I loved it. Yeah.
Okay, so 5 months for Sloane.
Yeah, so starting to see small changes, the tremors that have gone away, but stronger core strength. She's a more stable sitter. She crawls. She doesn't walk, but she's like so fast at crawling. One of the lifestyle things that I didn't know if we'd ever be able to do was send her to school. She started school.
Wow. You probably can't answer this fully, Jen, but I'm going to ask anyway. Is there any idea of how far they might progress? I know that these are pioneer patients, right? But
Oh, you mean like continuing the care?
yeah. 5 years from now, if
I
Susannah
defer to
Sloane
Stan. No, I mean, I think it's safety. I mean, there's a really close communication. I mean, any little issue that I'm concerned about, I can reach out to n-Lorem. So for the clinical providers who are making recommendations, you know, I definitely know it's a clunky pathway, and it's not straightforward, and it's not an easy recipe for anybody who's actually doing it, and every patient's different. But the availability of the clinical team at n-Lorem has really been great to kind of work through that, and I'm hopeful that as we do this and figure out, well, when are we on trial and when are we off trial, and you know, how do we work with the FDA? I think it's going to be we're going to be just doing it together and figuring it out until it's safe. I mean, unless there's issues about safety,
Yeah.
and efficacy. I think that's going to be a decision between everyone.
Yeah.
So I don't know
Do either one of you have thoughts on that? Like,
how long.
you know, is there a
Talk too much.
You know, we have been lucky because Susannah and Luke and Sally have been our pioneers, and they've really tested this out on Susannah so that they could make sure it was safe for Sloane. So we're just kind of following in their path, and they felt like maybe 100 was too much last time, so they're going back to 80. So we're going to stick at 80 for a little bit, and we're going to work with Dr. Bain and n-Lorem, and you know, we might want to try 100. I mean,
Yeah.
we're in this to give her the best quality of life.
Yeah.
And so as long as it's safe, and I mean safety obviously, I think we're willing to try what they recommend.
Yeah. I have one thing left. So to prepare for this, I went back and listened to your interview on Stan's podcast. This was like 2 years ago. Wendy was on that podcast. Have you listened to that since?
Yeah.
I mean, I have to say that the tone was quite grim on that podcast. I was a little
Yeah.
shocked. It was sort of like, you know, Wendy would explain what maybe the considered natural history would be, and would have to apologize to you for even saying these things out loud. And
yeah.
I mean, the tone has completely changed 2 years in.
Yeah, I mean, and we just did a follow-up podcast with Dr. Bain.
Yeah.
And yeah, I mean, Susannah she still has a lot of challenges, but she was really very sick. And now she's really happy. She's still sick and still has challenges, but at least she's making it through the day. She's happy, and she's able to have a conversation with her brother. Yeah, and then again, I mean, excuse me.
Yeah, it's just meant a lot to your family.
Yeah, and to see my son be able to, to see my son be able to have a relationship with his sister that's not just being a young caregiver is meant a whole lot.
Yeah. Yeah. That is right at perfect time.